Elaine Chong, BBC News.
Let's now speak to Dr Lesong Conteh, Professor, London School of Economics, who's been researching in the economics of malaria and diagnostics in Africa. Doctor, thank you so much for your time on this. I want to begin by getting a sense of the significance. This particular intervention, by how much is it expected to bring down fatalities in children as a result of malaria?
You'd expect it to have a substantial amount of impact. I haven't done the modelling. There'll be experts that can give you specific numbers. But as your video alluded to, the total number of people affected across Africa is significant, 95% of all deaths. And again, this cohort, the infants, are a sizable part of that. So any step forward in optimising treatment for this group of children between 2 and 5 kilograms will make a huge difference.
One challenge that's always been there is access and affordability. How do you see that being handled in this particular case? What would be ideal?
So there's been some really creative financing mechanisms in malaria over the years. I mean, we started with chloroquine and another drug commonly referred to as SP, which were 5-10 cents. And then in 2000s, we moved to drugs like Coartem, artemisinin-based combination therapy, and they became substantially more expensive. So we had to think creatively. There has to be subsidizes, global treaties. And so this isn't new ground. What will be interesting, because your video alluded to it, is that you can access these in the private sector, in private pharmacies. What we need is to ensure that these spill through the public sector efficiently. And those in most need, those that are often seen as most vulnerable, infants, pregnant women, marginalized communities, have access to these drugs.
What other gaps would you say there are in the treatment and prevention of malaria that you wish and hopes scientists will continue to work on then?
Great question, the gaps. I mean, there's interesting innovations in terms of this space in vaccines, and they've been widely publicized. And even the more routine things like bed nets, we shouldn't sort of overlook things that we know work, and we should make sure that the coverage is there. I think we made great progress in expanding coverage, but it's around uptake in some of these issues. So it's all well and good having these flow through a system and ultimately reach primary healthcare settings. But we have to ensure the end user, be that the community health worker, the caregiver, the nurse on the front line, that they are aware of the benefits of this, they're aware of the correct treatment, the correct diagnosis, and can act, because if you like, it builds trust, and then that's the trust that's sort of the bedrock of any effective improvement in population health.
Dr Lesong Conteh, thank you so much for your time. Very insightful. We appreciate you joining us on the program to discuss this intervention.